Test, test. We'll just get started. All right, good morning, everybody.
Recording in progress.
With the hour of 8 a.m. having come and gone, the Appropriations, Health, and Human Services Committee shall come to order. We don't have any replacement letters. We're just doing subject matter. Okay. Well, we'll take the roll and then we'll stand at these. Okay. Clerk, if you could please take the roll.
Moeller. Here. Lilly. Weber. Here. Bunting. Present. Cochran. Davidsmeyer. Davis. Here. Faber-Dias. Grant. Grassi. Haas. Here. Holbrook. Hanson. Here. Hernandez. Howder. Here. Hirschauer. Here. Jimenez. Katzmol. LaPointe. Morgan. Morris. Here. Ness. Said. Here. We have 11 members present.
Great. We don't have a quorum, but we are, as I mentioned, we're just going to be hearing subject matter hearing this morning. Today we're going to have testimony from the Department of Children and Family Services and the Department on Aging regarding their budget proposals for FY27. We're also going to hear oral testimony from the following advocacy groups. We have the ACLU Illinois, the Office of the Cook County Public Guardian, the Coordinated Care Alliance, and the Illinois Association of Area Agencies on Aging. And then we're going to do a subject matter for House Bill 4662, sponsored by Representative Canty. So I think we are going to stand at ease for 1 minute while we wait for the DCFS team to assemble. And they will be our first agency to testify. Okay, it looks like we have the DCFS team here. You're invited to come to the table and present when you are ready. And just for members' awareness, there are a number of documents that have been provided in writing so that members can follow along as we go through the presentations. I don't believe we will have any PowerPoint presentations, so you can follow along with the written materials. And with that, Director Mueller, the floor is yours.
Thank you. Thank you, Chairwoman and members of the committee. My name is Heidi Miller, and I am the Director of the Illinois Department of Children and Family Services. With me today, I have a few members of our team, and I will have each of them quickly introduce themselves, starting with our Chief of Staff.
Good morning. My name is Jacqueline Dorch. I'm Chief of Staff with DCFS.
Andy Munamoto, Chief Operating Officer.
Brian Turner, DCFS Budget Chief.
Thank you for the opportunity for us to present our FY27 appropriation request to you today. I'll start off with just a quick overview of the scope of the work that DCFS does. In FY26, the department received over 238,000 hotline calls. We investigated almost 80,000 investigations. There were 15,773 youth in care as of the end of FY25. In FY25, 4,826 children entered foster care, and something we're really proud of, more children exited to permanent homes. 6,248 young people achieved permanency. We also served 4,371 families with prevention services. Before we present to you today what our appropriation ask is for FY27, I want to spend just a little bit of time highlighting some of what we accomplished with the appropriation that the legislature approved in FY26. In calendar year 2025, DCFS achieved several really substantial milestones. And I'm going to start with one that's directly tied to the appropriation that we received last year, which is that we were able to meet our consent decree requirements for our investigator caseloads and vacancy rate. Thanks to the legislature, DCFS received appropriation and headcount, which was sufficient for us to really make remarkable strides in hiring. In 2025, we hired 388 new employees, which allowed us to reach the highest staffing level that we've had in decades. As a result of that, at the end of 2025, DCFS was able to petition the federal court on one of the core requirements of our BH consent decree, which has been in place for 3 decades. So in 2025, DCFS was actually able to comply with a component of the consent decree related to investigator caseloads and vacancy rate that actually has been in place since July of 1994. So 31 years later, we actually achieved it. And in January of 2026, the court filed an order signifying that DCFS had reached substantial compliance with this component. It's not just consent decree compliance, however, that is impacted by having appropriate caseloads. When investigators have lower caseloads, they're better able to do their work, they're better able to engage with families, and we actually achieve better outcomes for our young people as a result. And a prime example of that is that in 2025, DCFS achieved the highest permanency rate ever in the history of DCFS. So what that means is more young people left DCFS care in 2025 to permanent loving homes than ever before. And that's because we had a record number of adoptions in 2025 and a record number of guardianships that were completed. Another kind of key accomplishment in 2025 that relates directly to our FY26 appropriation is that DCFS was able to add 105 specialized bed spots for our young people with significant behavioral health needs. And those beds included not just residential placement, but also specialized foster care placements. But one of sort of the key highlights last highlights that I want to leave you with before we talk about our budget ask for this year is something that we're exceptionally proud of, and that is that Illinois DCFS has been ranked #1 among all states in the whole country in kinship care. The Federal Administration for Children and Families published an issue brief in March of 2026 listing the states, the sort of best performing states for kinship and relative care and the worst performing states. And Illinois was ranked #1 among all states. This is something we're really incredibly proud of, and we again have to thank the legislature for passing unanimously the KIND Act, which is one of the pieces of groundbreaking legislation that has allowed the department to really focus on supporting families and has allowed us to reach this monumental achievement of being first among all states in relative caregiver. So our ask for FY27, our budget request is $2.49 billion. That is actually a maintenance budget. It's almost a flat budget. Our ask for FY26 was $2.46 billion, so it's a 1.4% increase. And while on the surface that seems like almost a flat budget, it actually reflects some realignment, some government realignment, and some sort of major changes that I just want to point out to you and highlight before we get into questions. So the first sort of significant change that I want to point out is that as of July 1st, DCFS is transferring 188 of our employees to the Illinois Department of Early Childhood. Those are our daycare licensing staff. They will transfer over to the new department, and that you will see in our budget that's reflected as about a $20 million decrease because of that personnel shift. Another decrease that you will see in our budget for FY27 as compared to FY26 is about a $20 million reduction in our foster care line, and that is really reflective of the fact that DCFS has had exceptional success in helping children find permanent, stable, loving homes. And in fact, over the past 2 years, for the first time ever, more kids have left DCFS care to go into permanent, loving homes than have come in through the front door. One more area of reduction that you will see in our FY27 budget request is about a $13 million decrease in our EDP line. That is related to some government realignment where we no longer are sort of being billed by DoIT for tech DoIT personnel, but instead DoIT is getting its own appropriation line. So those reductions in our budget are offset by a few increases that are also really important to note. The most significant of which is the fact that the Comprehensive Community-Based Youth Services Program, CCBYS, will be transferring to DCFS as of July 1st. That program currently sits in the Department of Human Services. It's coming to DCFS. That's about a $35 million program, most of which is in grants that are distributed to community-based providers. You will also see a $25 million ask increase for our adoption and guardianship subsidy line. Again, that is reflective of our tremendous success in helping young people achieve permanency, and that funding is to ensure that we are supporting the people who have opened their hearts and homes to our young people. So those are some of the key sort of shifts in our budget. And with that, I am very happy to take any questions that the members might have.
Thank you, Director Mueller. Appreciate your testimony, and I'm sure there will be some questions. But before we start with that, let's add Leader Lilly, Representatives Favor Dias, Ness, LaPointe, Jimenez, and Katzmull to the roll. All right. Are there any questions from members for Director Mueller and her team? Representative Ness.
Thank you, Chair. Good morning, everybody. It's nice to see you. I'm going to ask the question that I sent you, just to put it on the record. I know we've been dealing with the insurance liability issue over the last year. So last year, I believe it was $6 million that was designated towards subsidizing some of those payments. Do you have that figure for this year?
Yes, the figure for this year is $9.4 million that we are appropriating to those liability insurance payments.
Yeah, thank you for that. And just for the committee's sake, you might recall in veto session, I passed a bill that authorized the Department of Insurance to conduct a study of this issue and why rates have gone up so high. And so we do have the report, and we'll be looking at that more closely to find a way to do a long-term fix to this issue. But in the meantime, I think it's important to note that in our budget, in your budget, we are continuing to have to dedicate funding to this issue, which takes that funding away from critical services, intact family services, and the other things that you're looking to grow. And despite that, you're still doing a lot of really good work. It's great to hear the numbers going in the right direction, right, that we want to see. But we know that there's still issues. The other thing that I wanted to or that I was curious about, so your head count, you said 188 are leaving
Yes.
and going there
Yeah.
to the early childhood, right?
Yes.
And that starts July?
July 1st.
Okay. So we should be directing licensing questions going forward to a different agency.
Yes, to the, to the Illinois Department of Early Childhood. We are, though, I will say that, the goal with that, with the creation of that agency and with this transfer is to really make sure that there is absolutely no break in operations. And so DCFS is continuing to provide a lot of structural support, a lot of infrastructure support to that agency as they continue to build their infrastructure. Our Chief Munamoto meets with them regularly, and he's really coordinating our efforts to try to make sure there's really as smooth as possible a transition of all the employees and also, files and payroll and all those infrastructure services that they're going to need help with.
Sure. Thank you for that. And then just the last, more for the committee's sake, just to connect some dots. General Services, we just saw do it yesterday in our Committee of Appropriations, and you will see the reflective changes switching over rather than DCFS paying for the personnel payments for those do-it employees. They now come out of the do-it budget. But there's still dedicated staff to DCFS, and this is, I think, an exciting change that we're seeing, and I just want to point to a positive among that and just let people know that you can see that reflected in other budgets. So thank you for pointing that out as well. No further questions. Thanks.
Thank you, Rep. Ness. And our next question, Representative Hernandez.
Hi there, good morning. Thank you, Director, for everything you shared today. I'm seeing here the head count for personnel for Hispanic being 9.8%. Compared to other racial groups, this is pretty low. So what are you doing to increase that number? Because 9% is actually pretty low.
Yeah. I will note first that percentage almost exactly matches the demographics of the youth that we serve. About 9% of the youth we serve are Latino, Latine. But we have actually done a lot of really intentional targeted recruitment, both, especially towards bilingual, Spanish-speaking bilingual staff, and actually have increased the number quite substantially over the past few years of our bilingual Spanish-speaking staff. In fact, as of last month, we actually came into compliance with another one of our consent decrees, the Burgos consent decree, meeting our targets there for increasing our Latine bilingual Spanish-speaking staff. So it's something we've been working really hard on. I do have to give credit to Kim Bates, who is here with us. She's our Director of Employee Services, and she's kind of the genius behind both us reaching substantial compliance with our BH consent decree overall in hiring, and also getting us into compliance with Burgos because of our really effective targeted recruitment strategies.
Okay, thank you.
For Spanish-speaking staff. Thanks, Kim.
Our next question from Representative Lapointe.
Hi, DCFS. Thank you for being here. Hi, Director Miller. I'm sorry I was late. There was multiple work groups and committee hearings happening before this one. I have a few questions and a comment, and we have a lot to pack in, so
Yes.
I give you permission to be concise and brief. So for the for the Comprehensive Community-Based Youth Services, CCBHC, no, CCBYS, thank you. Too many acronyms under this silo. You noted that that is transferring from DHS to DCFS, and that is going to cost $35 million. So can you give just a summary of CCBYS for the committee and talk about does that 35 million represent any sort of increase from what DHS was doing?
Well, I'll start with the second piece. It does not. It's a just straight transfer with no increase. CCBYS, Comprehensive Community-Based Youth Services, are authorized in the Juvenile Court Act, and they were created by the legislature as a prevention program in order to keep young people out of the child welfare system and out of the juvenile justice system. So CCBYS services are meant to exist, in every jurisdiction and really used to kind of provide like crisis response, respite, stabilization for families. And then they also do some really very front-end prevention work in schools, in communities, really to keep kids who are at risk, from entering the juvenile justice system or families that are at risk from entering the child welfare system. So I'll just note that I used to be a CCBYS. I used to work with CCBYS programs when I worked in the community, and I have long been a really ardent champion of CCBYS as a core component of our sort of continuum of care for people in the community in Illinois. It's something that I'm really excited for DCFS to support, and it really aligns and fits very well with our other prevention services like crisis nurseries, like family advocacy centers. We are building really a strong prevention division within DCFS. It's another thing that the federal government is now recognizing us as a leader in. And this really complements that and helps us enhance it. And the kind of last thing I'll say about it is recently the Federal Administration for Children and Families has kind of broadened their interpretation of what prevention services count under the Family First Prevention Services Act. So what that means is there's a broadening of the interpretation of what we could, as a state, get federal reimbursement for. And so we are exploring at DCFS how we might be able to access those Title IV-E Family First Prevention Services Act funds to reimburse some of the evidence-based work that our CCBYS providers do.
Can you name two of the providers just so we can wrap our heads around who they are? And does anyone at the table have any information about average salary for a frontline professional at one of the CCBYS providers who I'm sure are nonprofits?
So I can tell you, I guess I'll start with the organization that I used to work for. Youth Outreach Services has a CCBYS program. A little shout out to Youth Outreach Services. I may be biased, but I think they ran a really, really excellent CCBYS program. We don't have today information about the average salary for a frontline CCBYS worker, but that's something that we can get to you, as we go forward.
Great, thank you. And then for the $25 million increase to the guardianship and adoption line, which, as you mentioned, you're seeing really good outcomes there. What does that translate to an actual foster or adoption family in terms of how much money they might be getting from the state per month?
So, could you say that again?
Yeah, and I can rephrase the question. So for the $25 million increase to the guardianship and adoption line, how is that operationalized for a foster family or an adoptee family? What does that translate to in terms of how much a family's getting or how much help a family's getting per month?
So yes, the average monthly subsidy for a family is $735.52.
Okay. And does the increase of $25 million that we're going to see in state fiscal year 27 proposed, does that translate into an increased amount for families like you just referenced?
Yes. So there's kind of two things that contribute to that increase. One is just the sheer numbers of people that are, the sheer numbers of kids who are achieving permanency through adoption or guardianship. So the number of adoptions and guardianships is going up. So that accounts for some of the increase. And then the amount that we are providing in that subsidy is also going up. So those, both more people and they are getting more in subsidy.
Gotcha. Okay, thanks. And the last thing I wanted to say, triggered by what Rep. Ness mentioned, thank you for working with many stakeholders to try and resolve this insurance liability issue. As we sit here on Health and Human Services, I just want to point out it is very, very difficult for me to stomach that we are appropriating $9.4 million, essentially handing it over to insurance companies when the administration is proposing to cut the homelessness budget, just for an example of something they're proposing to cut, by $11.4 million. Those are similar numbers. So if we actually could fix the structural issue of foster care liability insurance, perhaps we wouldn't have to cut the homelessness budget by $11.4 million when the people in my community who are living on the street cannot access shelter. And there's many instances in the budget where we have to make cuts or there are being proposed cuts. So my point is, let's fix this issue because we have deep human needs in the state budget, and I cannot stomach cutting the homelessness budget, for example. So thanks, Rep. Ness, for leading that charge, and I hope we can resolve that issue. Thank you, Chair Mueller.
Thank you. I do want to note, we feel similarly about having to spend funds that, should go to kids and families to address these, ever-increasing foster care liability insurance rates. One thing that makes me feel more hopeful now than I felt at this time last year about it is that there does seem to be some awareness and some kind of acknowledgement and willingness at the national level to actually address this. There seems to be an acknowledgement that this is not an issue that a state can fix on their own, but that this is really a market issue and that there needs to be some work and some adjustment that happens at the national level in order to address it. So I know that, Andy Durbin and ICOI have been involved in some congressional testimony. I was in DC in March and we talked about it with the Administration for Children and Families. I believe on Monday they're holding a roundtable about it. The National Association for Insurance Carriers is looking into it. There does seem to be some movement nationally, recognizing that this is something that is way beyond the capacity of an individual state to try to adjust because it's about risk pool across the whole country and the market. And so I'm excited that we have folks like Andy who are considered national experts who are at the forefront of this issue and are advocating for us, and I think we might see some movement.
Thank you, Director. And I know that this is something that our Department of Insurance is also working on with other states to pool that risk. So it's good to see that there's progress being made on that level. Our next question comes from Representative Davis.
Yeah, thank you. Congratulations on hitting some of those milestone numbers that you presented at the beginning. That's a big accomplishment. I have a quick question. I know that often kids, not often, but youth can go missing in foster care for a variety of reasons, often out of control of the department from a runaway perspective or what have you. I'm curious the dollars that the department allocates annually to seek, find, and return those kids back into care.
That's a great question. DCFS actually has a division that is dedicated to receiving reports of anytime a young person even leaves their placement, even for an hour. And that division and to, work with law enforcement, work with state police, sometimes with the FBI, to try to identify where kids are. We can try to break that down for you. It's really personnel that we dedicate funding to that do that work. A lot of that work is actually collaborative work that involves, partnering with other agencies like police, like FBI, like other folks who do this work. So it's kind of hard to assign a dollar amount to that. It's human effort and work. But we can break down for you the cost. I don't have it here today, but we'll get you the cost of that division.
Yeah, that would be great. Thank you very much. No further questions, Chairwoman. Thank you.
Thank you. Representative Faber-Dias?
Good morning. Thank you all so much for being here, and congratulations on the significant progress you all have made. One of those areas that I was just curious about when you talked about, the kind of the record hiring that you've been able to do for caseworkers, what's the starting salary for a caseworker, and have there been, what has been like the history of that in the last few years?
I don't want to misspeak, so we're going to look up the exact number. I will tell you a little bit. I'll start with a little bit of the history of that. One of the things that, I really do have to give appreciation to our partners, our organized labor partners, AFSCME. All of our frontline caseworkers are in the bargaining unit, and that means that they get regular COLA increases, they get step increases as they progress. And so that actually is something about Illinois that makes working for this state really attractive. In fact, sometimes we, in the border state areas, we actually attract people from other states because Illinois pays better and has better benefits in some cases. So here we go. Thank you. Okay. Got it. So our starting salary, starting salary is $77,520. Sort of the average, the current average is $87,340. And that reflects, because you get step increases with seniority, because you get COLA increases as people progress in their career, their salary goes up.
Thank you.
Leader Lilly?
Thank you, Chairman Moeller, and thank you, Director, for the good work that you're doing. It is appreciated. Your reporting on the outcomes of your priority is key. Just to make a note, none of us are perfect, but we do see in our reporting there are some auditing findings that you may have. Is there anything you want to comment on any one of those, the good work addressing those?
Sure. I will, a few things about our audit. So the most recent audit cycle that you've received reports about is FY24. I do want to note that from FY22 to FY24, we actually cut in half the number of the material findings. What that means is, when the auditors do an audit review of an agency, they identify the findings that they think are sort of most critical. And then they identify findings that are maybe, sort of slightly less critical. And although there are repeat findings in the 24 audit as compared to the 22 audit, DCFS was able to reduce those most critical material findings by cut it in half, reduce it by 50%. So I do want to sort of acknowledge that I personally can't really take credit for that because almost all of that occurred before I came on board at DCFS. But I do think a lot of what it reflects is our fiscal team really doing a ton of work to put in place more structure, more controls, more segregation of duties that really address a lot of those audit findings.
All right, are there any other questions? Oh, Spokesperson Weber?
Thank you, Chair Mueller. Dr. Mueller, thank you, and congratulations on permanency accomplishments. That's pretty awesome. I know some of our questions were going to be about the transition of the 188 employees. It sounds like that's going well, and I appreciate that you did get back to us with some responses to our questions, so we don't have as many as we had. I know when we were talking about the $9 million that's being spent to continue the insurance liability, do you know how many other states are having that risk pool issue? I know it was California and Illinois to begin with. I didn't know if that number has expanded.
Yeah, thank you for that question, spokesperson. That's a really good question. When I was in DC in March, there were several other states that raised this issue. I think we're seeing it in, in California and Illinois, in Washington State, I believe in Oregon. I think Texas is starting to see this issue. There are probably more states than that, and I'm not certain at this point, like, of the totality of all of them.
So it sounds like it's something that's spreading, right?
It's spreading, yeah. It is definitely spreading, and there seems to be, among my colleagues in other states, there's a growing sort of concern about it.
Yeah, well, I could only imagine where we'd be if we did not have that insurance. The other thing, and I don't know if you can answer now, but in the case of AJ Friend from McHenry County and the conviction of the caseworker in that case, has that altered training, management, any type of procedural that the department does?
Yeah, I think, and again, that case, was sort of well before my time, and so I kind of can't speak to all of the things that the department did at that time in response, but there have been a lot of sort of improvements and, changes in training in the way we approach the work. I mean, actually, like, child welfare work I think of it a lot like the field of medicine. It is a science-based field, and it's something that is constantly evolving, and it's something that we are constantly sort of pushing ourselves to continuously improve on. So, every year we're changing practices, we're adding training. We have added additional training in the form of our sim labs. We've expanded our simulation labs. So what those are, for folks who don't know, like, our employees, when we hire them, go through a training process, and part of that training process is they actually go to a simulated home, a simulated site where they can sort of get the feel of what it's like to walk into a home and what things they need to pay attention to. We have actors who kind of help them go through that process. They also get to do a simulated courtroom experience, these things that, just even as a social worker coming out of school, you don't necessarily know what it's like to walk into somebody's home, and know what that experience is. So we've added more of that.
I appreciate it, and I only ask because I would hope that was a learning experience and not something that just goes to the wayside, to make sure that doesn't happen to another one of our youth here in Illinois. So I appreciate it, and I also appreciate you keeping us up to date on cases locally and other things. So I really do appreciate that, and want to say thank you. So
thank you. I will say, this is something. This work is incredibly challenging, and I said this in my Senate hearing too. This is truly the hardest job I've ever had, not just because the work is massive and intense, but also because the work is incredibly heavy. And the people who do this are every single day stepping into moments of crisis and trying to weigh making an impossible decision. And I think we carry all of that on our shoulders every day. I probably personalize it more than I should because it means so much to me. But you know, I think I appreciate the question because it's something that, you know, we just talked about this morning. We don't really sleep anymore. And I think most of the people who work for us and with us feel that way too. And so, you know, it's we are obsessed with continuing to try to improve, to try to learn, you know, to sort of look at what our best practices nationally, what our best practices in the field, and continue to sort of update our work and be in this space where we keep learning and growing.
Thank you. Let's add Leader Morgan to the roll, and we have a question from Leader Haas.
Thank you, Madam Chair. Can you tell me if most of your caseworkers are working from home or if all of the field offices are open at this point?
All of our field offices are open. Most of our frontline caseworkers actually work in the field. So they're in the community, they are in people's homes, they are in offices when they're doing their notes, you know, when they're doing their supervision, but our caseworkers are actually mostly out in the field in the community.
So it's understood that they're working not home-based any longer. They're coming into the office every day, and home-based work is not an option any longer, I guess is my question.
So for our frontline caseworkers, their supervisors are able to give flexibility in hours, so they may have a day that they're able to work from home, but it's really driven by operational need. So if you're a caseworker, you know, a big part of your job is actually not in an office or at home, but actually in the home of the clients that you're serving, the families and youth you're serving, or in a school or in a police station. And so that's the majority of where they spend their time. We do have expectations that our caseworkers show up in offices, especially when, you know, there are mandatory meetings that we have in our office spaces, and when they have one-on-one supervision with their supervisors, that's the expectation. But, you know, like I said, we do allow our supervisors to give some flexibility around hours depending on operational need.
Thank you for that. I just wanted that clarification that we aren't having our caseworkers work from home. I know there was some concern that hotline workers were working from home. Is that still happening?
Yeah, hotline workers can work remotely. Caseworkers do not. So there's a distinction there because the hotline workers are really, they're answering either calls or they're getting reports, you know, online on the computer.
Okay, thank you for that. You know, my work in the community as a mental health professional, LCSW, is concerned with access. And I know that in my other world with boots on the ground, that's still been a concern. And been hearing that caseworkers are working from home. So, you know, perhaps that's a discussion we can have outside of here. But my concern was, is it reflected in the budget then if people are not working from the office and if they're working from home and from that perspective and the supervision and oversight from that perspective as well. Thank you.
That's a good point.
Thank you. Are there any other? I'm not seeing any other. I just had two questions, comments. Again, thank you, Director. We had a lengthy discussion last week in our pre-meet. I echo the comments of many of my colleagues and expressing gratitude to the improvements, the dramatic improvements that have been made at the agency over the last several years. You know, this was an agency in crisis, and the changes and improvements have been duly noted and very much appreciated. There were And two of the areas that I think received a lot of attention were, one, the hotline, and kind of referencing what Leader Haas was talking about, the number of calls that were coming into the agency and the amount of time it was taking for responses to be made for people, notifying the agency of potential abuse and neglect. Noted in our budget materials that was an audit issue, an agency issue, but there has been progress that's been made in addressing that. Can you just kind of give a brief overview on how the hotline calls are being handled and the timeliness improvements that have been made?
Absolutely. I'm actually thrilled to talk about this because it is a huge accomplishment of the department. What was reflected in those audit findings, we went from a place where our hotline workers were taking messages and sometimes not able to get back to people calling for days. That was where we were at. Today, we answer every single call in an average of 24 seconds, in real time with a real person. And we were able to do that because we had really fantastic leadership, overseeing our hotline. We did a rapid results project with the state, so we kind of did some Lean Six Sigma looking at our processes, and we really looked at streamlining and getting rid of overly bureaucratic processes that were getting in the way of us being able to answer those calls more quickly. We also built our system into our Illinois Connect technology overhaul, which is something, we're still in the process of doing, for the whole agency. But by doing that, we were able to actually create a system that sort of tracks in real time, the information that's coming in and can send it directly to the field. So we've made that process just leaps and bounds more efficient and effective. And like I said, today, we answer every call in an average of 24 seconds.
Great, thank you. Yep, that's a major improvement. The other area that had received a lot of scrutiny and kind of was an ongoing issue are youth staying in our hospitals beyond medical necessity. And I know there is still a capacity issue with that, but can you talk a little bit about what's happened over the last couple of years and what the plans are to address the capacity needs for some of our youth in care and also youth who are experiencing mental health crises that are not able to be placed back into the community because of capacity?
Absolutely. I think, there's kind of a lot to talk about in that respect. We have seen in DCFS, and I think child welfare systems around the country have sort of started to become de facto behavioral health care systems for adolescents. We've seen a pretty dramatic increase in the number of young people who are being ordered into DCFS care as no-fault dependency because they cannot access behavioral health care services because they need behavioral health care services. So those young people, are ordered into DCFS care partly because we are the one state agency that will respond within 24 hours, and we have that capacity to be sort of nimble. But it doesn't mean that we have a magic wand that can actually produce, residential treatment beds or the behavioral health care that our young people need. What we are doing to try to respond, and it is one of our kind of core strategic goals, is to really sort of continue to enhance our response to our young people with behavioral health challenges. We have seen, although it is not immense or as significant as some of our other achievements, we have seen a reduction in the number of kids who are in hospitals waiting for appropriate placement. As I mentioned at the start of my testimony, in 2025, we did add an additional 105 specialized beds for our young people. But we're really looking at this as a multi-pronged kind of issue and a multi-pronged solution. So it's not just sort of creating residential beds. And, the issue there is actually there on any given day, thanks to the work of our Children's Behavioral Health Transformation and Dr. Dana Weiner, we're actually able to see how many beds are available and what beds are available. We never had that capability before. So any given day, there are about 170 beds available. But the issue is, what population do those beds serve? Through our increasing work with Dr. Weiner, we can see that we actually have more beds than we need in some, for some populations. And then we don't have enough beds to serve young people with autism spectrum disorders, developmental delays, kids who have experienced human trafficking. We don't have enough beds to serve our dually involved population or kids with problem sexual behaviors. And what we see is often particular behaviors, fire setting, problem sexual behaviors, delinquency become automatic bars for providers, sort of accepting kids into residential placement. So what we're doing is we're trying to be really focused on what are those populations that really need specialized care and treatment, and how can we be really specific and creative about ensuring that they have the whole suite of services they need. That is another challenge. We have a young person who might have multiple, they have a history of trauma, and they have experienced trafficking, and they have an autism spectrum disorder, and they have significant mental health needs. And we may have a provider that addresses trafficking, but can't take a young person with autism. And so really trying to create these specific suites of not just residential, but community-based wraparound services is what we're trying to do to address this. I am really excited. We have spent the last couple days at DCFS essentially kind of pulling everything out of the closet around how we address our young people with behavioral health needs, including, managed care, including our own clinical services, and really saying we're going to break this apart and we're going to build it around what kids and families truly need, instead of just trying to sort of expand an existing structure and program that isn't necessarily addressing all of those needs. You will see us in the coming fiscal year really focus on that project. And so, there will be lots more improvement and progress, I think, to come.
Thank you so much. All right, are there any other follow-up questions? All right, I'm not seeing it. All right, thank you again, Director Mueller and your team, for all the work that you do, and thank you for being here this morning to talk about the proposed budget and what your plans are for the coming year. Thank you again for all the work that you do and passion that you put into your job. So thank you. We appreciate it. All right, our next panel. So we're going to have two panels that are related to the DCFS policy area. Our first panel is the ACLU. We have Nora Collins Mandeville, the Director of Youth and Family Policy Project.
Good morning, Chairperson Moeller, Vice Chair Lilly, Spokesperson Weber, and honorable members of the committee. I appreciate the opportunity to speak with you this morning about the importance of the DCFS budget. As you heard, my name is Nora Collins Mandeville, and I'm the Director of the Youth and Family Policy Project at the ACLU of Illinois. The ACLU represents all youth in the custody of the Department of Children and Family Services in a federal class action lawsuit, the BH consent decree. In that case, youth in DCFS care continue to demand the department's full compliance with promises to provide them with appropriate services and care. We appreciate Governor Pritzker's continued focus on DCFS and the investment shown in his proposed budget for the upcoming fiscal year. DCFS must make a concerted effort to continue to improve services and respect the legal rights of young people in the department's care. As you know, DCFS's budget is more than a set of line items. Each of those lines represents service delivery to thousands of young people across the state who are or could easily be in the custody of the department. Funding decisions related to youth in state custody must be driven by children and youth's fundamental rights. Unlike years past, the ACLU sits before you this morning not only to advocate for necessary resources for DCFS to continue to improve its work, but also to recognize that DCFS is moving from goals on paper to delivering for youth and families in some key areas that are the focus of the ACLU's long-term work in the BH consent decree. For the past 3 years, enforcement in our decree has been occurring through implementation plans that address some of the most urgent needs of youth in state care. Because the plans focus on the most urgent points of concern, the satisfaction criteria for implementation plans are narrowly tailored to address those highest level needs to materially improve conditions that youth experience in the department's care, including improving permanency for youth who have been in the care of the department for 2 years or more, as well as youth who have been in the care of the department for less than 2 years. Reducing the occurrence of maltreatment in care, and improving stability and service delivery for youth with complex behavioral and mental health needs. The ACLU has seen notable improvements from DCFS over the past year in meeting some of these consent decree requirements. Through improved staff management approaches, including better tracking and oversight, increased agility in addressing sites before they become overwhelmed, and resource investments from the General Assembly, DCFS has substantially complied with the consent decree requirement, as you heard, with limiting the number of new investigations to child protection staff. This achievement is not merely administrative. When the child protection workforce is overstressed, it compromises the integrity and soundness of the life-changing decisions we ask investigators to make on a daily basis. Maintaining a manageable volume of new assignments for each investigator will improve the quality of DCFS's investigative safety determinations. As a result, the department will be better equipped to serve its mission of focusing on supporting youth across the state by minimizing unnecessary family separations while focusing critical resources on youth in harm's way who are in the most need of state protections. More good news. As you also heard, the court-appointed expert panel in the decree has certified that DCFS is achieving one of the other implementation plan's satisfactory criteria, and that is improving permanency for youth who have been in care for 2 years or more. For many of these youth, reunification and adoption have not been feasible permanency options. Achievement of this goal has been the result of the department's increasing priority on kinship care at the outset of cases, as well as pursuing guardianship, which is optimal because it allows youth to maintain critical connections to their family, even when reunification with a parent isn't a possibility. DCFS needed the investment from this body to make this progress. Your budgetary investments, especially when coupled with the passage of sweeping substantive systemic reforms like the Kinship and Demand Act, allow DCFS to focus on protecting youth and families' rights, improving outcomes, and right-sizing the agency and its scope. We need that investment to continue even with DCFS's progress. DCFS still needs to achieve more under the BH decree, and must continue to improve permanency outcomes, not only for guardianship and adoption, but for reunification too. Now and in the coming year, it is critical that DCFS make material progress in addressing more areas of the current implementation plan to address high priority issues. These include reducing maltreatment of youth in the department's care, improving services and supports for youth with higher level needs, and decreasing length of stay, particularly for youth who are involved in cases that have been open under 2 years. In addition to DCFS's commitment, this will require further efforts to right-size DCFS, as well as investments in staff and community-based supports for families. It will require the department to stay the course and make data-driven decisions rooted in best practice to diminish adverse outcomes in a sustainable manner. While we can't tell you a magic budget number, what we can tell you is that the investments you've made in recent years have helped DCFS make progress. Continuing to make progress and doing so in a sustainable manner will require sufficient resources. I urge you, please, make these investments again this year. Thank you for your time and attention and for the work that you're doing to help children and families across the state.
Thank you, Ms. Collins-Mandeville. We appreciate your testimony. Let's make sure that we've added Representative Katzmull to the roll. We're going to have our next panel, the Office of Cook County Public Guardian, Danielle Gomez, testify, and then if there are any questions for these two panels, we can open it up to members. But I do want to remind everyone, we have the Department on Aging, and then 2 more advocacy groups, and then a subject matter on a bill, and we need to kind of get out of here by hopefully closer to 10. So, but we understand this is all very important testimony. So with that, Ms. Gomez, feel free to start.
Good morning, Chair Moeller, Vice Chair Lilly, and Spokesperson Weber, and members of the committee. My name is Danielle Gomez. I'm an attorney with the Office of the Cook County Public Guardian. The Public Guardian is court-appointed as the attorney and guardian ad litem for approximately 6,000 children who have allegations of abuse, neglect, or dependency pending in Cook County courts. Over the past few years, there have been increases in appropriations to DCFS, and of course, that investment has been welcome and necessary, but must be accompanied by transparency and accountability to ensure that DCFS is investing in interventions that meet the needs of children and keep children safe. We are concerned about lack of sustained positive outcomes for youth in care waiting for placements, despite several years of increased investment, and about recent incidents where DCFS failed to meet the needs of children. But most concerning is that DCFS delayed and obfuscated before providing public information antithetical to the transparency we would expect of a public agency. 8-year-old Markel Pierce died in February after suffering years of torture by his mother and her boyfriend. State law requires that DCFS provide certain information to the public when a child with whom the department has had prior involvement dies. In the recent past, DCFS has released timelines of its involvement with children within days of the child's death. This is not a game of gotcha, but a necessary, transparent, critical analysis of how appropriations translate into policies and practices that keep kids safe. These policies and practices apply to children statewide and also apply to youth in the care of DCFS who are alleged to have been abused or neglected while in DCFS care. In Markel's case, DCFS initially reported that it had no prior involvement with the family. After a daycare owner went public with their allegations or their reports to DCFS, the agency said it was not providing services to the family at the time of Markel's death. DCFS also said it would not release a timeline in Markel's case because it was deferring to local prosecutors, who in turn released an initial statement that was revised 2 weeks later that the prosecutors do not control what DCFS releases and that they had not asked DCFS to withhold information. DCFS finally released a timeline in Markel's case nearly 6 weeks after his death and on the eve of the primary election, ensuring it would be lost in the news cycle. The timeline shows that DCFS received 8 calls to the hotline regarding Markel and other children in his household in the 3.5 years preceding his death. These 8 calls resulted in 4 abuse and neglect investigations and 4 child welfare referrals. The final call to the hotline before Markel's death was taken as a child welfare referral. DCFS's timeline does not indicate what the mandated reporter said to the hotline when they made the call. The assigned child welfare worker closed the referral after making attempts, but without ever meeting the family or Markel. Over the past few years, DCFS has utilized parts of its appropriations in a transition to the SAFE model as part of its efforts to right-size the front door by ensuring that the hotline gathers comprehensive information efficiently and effectively and ensures the response matches the family's needs. DCFS implemented the SAFE model at the hotline in August of 2024, right in the middle of the 3.5-year period that Markel's household was reported 8 times to the hotline. Preliminary evidence suggests that the SAFE model did result in a 9% drop in hotline calls being taken for investigation compared to the prior 4 fiscal years. And this might be a very good result for many children and families. But how did implementation of the model impact the decisions made about Markel? How is the safety of children like Markel, who were the subjects of hotline calls that were not taken for investigation as a result of the model, being studied and measured? This is the type of critical analysis, transparency, and accountability that should be expected, and if not provided, demanded from the department. System reform depends in large part on transparency and accountability in response to tragedies. Finally, over the past several years, the Public Guardian has strongly advocated for increased appropriations to ensure clinically appropriate placement capacity. Despite the increased appropriations, DCFS continues to leave children in locked psychiatric hospitals, juvenile jails, offices, and temporary shelters for weeks and months when the children should be placed in appropriate settings. DCFS's 2025 Waiting for Placement report demonstrates increases in youth staying in psychiatric hospitals longer than necessary, both in terms of the number of youth and the number of days on average that each youth stays longer than they should be there. The number of youth left in juvenile jails beyond the release date has not improved, and the number of youth spending nights in offices has only barely improved, from 709 instances in 1 year to 672 in the next. Appropriations must be accompanied by transparency, accountability, and investment in programs that improve outcomes for children and families. The Public Guardian has submitted written testimony, and I'm happy to answer any questions.
Thank you, Ms. Gomez. Are there any questions either for Ms. Gomez or Ms. Mandeville Collins? Okay. Representative Lapointe.
Thank you for your work at the Office of the Cook County Public Guardian. I just want to say for the record, the end of what you were saying sounded extremely important and compelling. A bunch of members aren't here, not because we're sitting outside drinking coffee, but because we are forced to be in other committees. So I don't want to waste anyone's time, but I missed 95% of your testimony. So Danny, can you make sure to email me your written testimony, because I really want to look at it and feel it and understand it.
Yes, absolutely. Thank you, Representative.
Yep. And even if we have it, I felt compelled to say that on the record, because the way the schedule is here, it makes it physically impossible for us to hear your really important words.
Spokesperson Weber, did you have a question?
Ms. Gomez, I just want to say thank you for the work that you do. And, you know, when we look at the case of Markel, and other youth, AJ Friend, the 16-year-old girl that was placed with a 26-year-old, shot, prostituted. We have cases where the caseworker said that the child looked sickly and ill, and nothing was done, and weeks later found dead. You know, we hear these cases too many times over the years, and so I was just say, keep up your work, DCFS, keep up your work. Move in the right direction. It looks like we're doing good things, but there's a lot of work to be done, so thank you.
Thank you.
Thank you, Spokesperson Weber. I echo those comments, and we are grateful to have the ACLU and the Cook County Public Guardian, and I know ICOI is going to be testifying next week with their thoughts on the proposed budget and other issues pertaining to child welfare. We're grateful to these organizations serving as a check and oversight on what we're doing at the state level. So thank you. And again, thank you to DCFS for all the progress we've made, but clearly there's much more that needs to be done. So thank you. With that, we're going to proceed to the Department on Aging. Director Killow, you are welcome to proceed when you are ready.
Thank you, Chair Moeller. We have a PowerPoint presentation. I just was waiting for it to come up. There it is. All right. Good morning, everyone. Thank you for the opportunity to be before you today to talk about the FY27 introduced budget for the Illinois Department on Aging. My name is Mary Killow, and I serve as Director for the Illinois Department on Aging. And along with me today is my CFO, Sarah Harris, my budget analyst, Emily Haltern. I do know your name, Emily. And my Chief of Staff, Liz Volt, and my Deputy Director, Becky Dragoo. And you can go to the next slide. I don't know who's going to. As many of you know, the mission for the Department on Aging is to serve and advocate for older Illinoisans and their caregivers by administering quality and culturally appropriate programs that promote partnerships and encourage independence, dignity, and quality of life. The total introduced budget for FY27 for the department is slightly over $2.2 billion. It should be considered a maintenance budget for the department, with an 8.5% increase over fiscal year 26. I wanted to go over just a little bit about what our major programs are and eligibility requirements and who we serve. Our largest program by far is the Community Care Program. Eligibility for the Community Care Program, you have to be over the age of 60, an Illinois resident, U.S. citizen, or meet eligible immigration status. And you have to be have non-exempt assets that do not exceed $17,500. And you're assessed for long-term care eligibility determination of need by the DON tool. And you have to apply for Medicaid and enroll if eligible. And throughout the state, this is the breakdown of individuals who are under the community care program, as well as under our waiver that are under the managed care programs. So total for both programs, we serve approximately 131,000 older adults. And the state is broken down for the Department on Aging on PSAs, or planning and service areas, and this is a breakdown throughout the state of the number of individuals we serve in each of those areas. And I'm contrasting that to the other large area that we serve older adults, and that's in our Older American Act services programs. These programs are partly funded with federal funds as well as state funds. And those programs are coordinated through our 13 area agencies on aging. And the eligibility is different for those programs. We do serve people over the age of 60 plus, but these programs are not means tested. However, we do prioritize these programs for individuals with the greatest social and economic needs. And listed are some of those areas that we look at. And adding on to that, for our home delivered meals program, which is one of our larger programs, we add to that that the individual has to be for home delivered meals, frail or homebound by reason of illness. And we are working to deal with issues of incapacity as well as social isolation. We also serve congregate meal sites, but those are for individuals, again, who meet the nutritional guidelines and those with the greatest social and economic needs. And here, again, is a map of those programs according to the planning and service areas throughout the state. We serve an average of 154,000 monthly average of 154,000 congregate meals, and an average monthly average of approximately almost 1 million meals a month. So the total for the year is monthly average is over 1 million for both meal programs. I want to demonstrate how this budget works in favor of some of our major priorities with the Department on Aging's mission. Primarily, 3 priorities I want to highlight: the aging in place, serving and providing quality and culturally appropriate programs and services, and then preventing and investigating and responding to abuse, neglect, and exploitation of older adults. The priority of aging in place, our largest program, again, is the community care program. The FY27 introduced budget is approximately $1.75 billion, and this reflects approximately $29 million increase that annualized a rate increase that was entered in the program January 1st of 2026. It also reflects a $135 million increase that is a reflection of a projected caseload growth as well as an increase in utilization. And then there's a $2 million increase for other programs that are part of the CCP program, such as adult day service and emergency home response, et cetera. Also under this line in priority is the care coordination units, which are the units that do the eligibility requirement as well as the casework for the community care program. And in the introduced budget, it's a total of approximately $97.3 million, and this reflects a utilization increase of approximately $4.4 million, as well as an increase of 4 new staff for the Department on Aging that will work on quality assurance and monitoring for the program. This slide reflects our investment in the direct care workforce. I know you're going to have a subject matter hearing pretty soon on this issue, so I won't go into it too deep. Other than I think this is a great slide, and I just want to show the difference. These are the rate increases over a period of time since 2018 to the current one. Our current in-home rate that we pay workers, the provider agencies, are $30.80. And our program, with our program, 77% of that in-home rate goes directly to the direct care workforce. So starting at the top going down, that next line, the red dotted line, the $23.72 reflects that 77% that goes towards the direct care workforce. And the line below that reflects the actual wages paid to the direct care workforce. So right now, with that rate of $30.80, that requires that each of the direct care workforce gets paid hourly a minimum of $18.75 an hour. And the very last line reflects what the minimum wage rate here for the state of Illinois is. So just wanted to show some of the differences and what the rate truly reflects in relation to the direct care workforce. In addition, I want to mention that the Department on Aging is undergoing a rate study. It has already started, and it's for all of our groups, including our in-home rate, our rate for other programs like adult protection, our rate for the care coordination units, et cetera. And although this is an operation in relation to what was required under federal CMS, we estimate that this rate study should be completed by the fall of 2026. Next slide. With regards to our second priority of providing culturally appropriate and regionally appropriate services, we want to highlight the budget towards these other programs. So with regards to the area agencies on aging that provide services as outlined in previous slides, this budget reflects approximately $73.3 million for home delivered meals and a budget of $17.6 million to maintain planning and service grants to the area agencies on aging, and it reflects $5.3 million to maintain caregiver programs that are administered through the area agencies on aging. In addition, under this line, we want to highlight another community-based program, and that is our Illinois Care Connection programs. This budget reflects $2 million towards that, and that's the program that prevents social isolation and provided needed technology to individuals in the community. Our third priority to prevent and investigate and respond to abuse, neglect, and exploitation is we want to highlight our APS program. FY27 introduced budget reflects approximately $29.7 million for the APS program, and this reflects an increase of approximately $3.3 million over FY26 enacted, and that money is to address several things, including quality towards that program, improving quality, as well as address the increased caseload size on issues such as financial exploitation. In addition, the Ombudsman's program has a slight increase of approximately $296,000, and this reflects a 2.9 increase in growth for a total introduced budget of $10.5 million for the Ombudsman program. And just very quickly, I want to highlight a couple of other things that we're planning for in the future. Hopefully everyone has seen our multi-sector plan on aging, which is Engaging Illinois, which is a comprehensive plan. It was filed in December of 2025 with 4 major goal areas: livable and connected communities, help for all ages, investing in caregiving, and affording aging. And it's a multidisciplinary, multi-agency approach on looking at aging in Illinois and looking at issues that we can address for the next 10 years here in Illinois. In our FY27 budget, there's approximately $1 million in it to fund proposed initiatives for the plan. In addition, the Department on Aging goes through a 3-year state plan on aging, which was effective 10/1/25. And so we are focusing on 3 areas under that plan, and that is to increase statewide visibility of aging network programs and services, to drive and improve quality assurance, and to increase awareness and knowledge of all our caregiver needs. And lastly, this is an initiative that came through legislation, but we have embraced this through also our multi-sector plan, and that is a caregiver portal. In the legislation, it required us to meet essential elements, meaning develop a special tab, et cetera, and that was completed in December of last year. And the legislation requires it to be fully operational in July 1st of 27, and we are online to do that. We have woven this initiative within the multi-sector plan and in working in collaboration with that plan to make that fully operational. Thank you for listening, and I'm open to any questions.
Great. Thank you so much, Director Kelo. I appreciate your presentation, and we also met last week, and I appreciate you including elements of our discussion in your presentation as well, including the caregiver portal and discussion on wages, which we know we're going to hear some subject matter hearing on that as well. Are there any questions? Representative Ness.
Thank you, Chair. Good morning. Thank you for being here. I know I'm short. I thank you for presenting the information, and I'm particularly interested in the 1 million meals per month is just an astounding number. I don't know if people realize the magnitude of that. And we benefit, every community across the state benefits in that. So I have a couple of questions, just a couple of things stood out to me. First of all, I know the Adult Protective Services, I think in your introduction webinar after the proposed budget presentation, you gave some numbers in that. Can you just repeat, how many calls do you receive, did you receive last year, and how many turned out to be actual cases of abuse or issues?
We had approximately 25,000 intakes for on APS, and a lot of them come through our senior helpline, which is an avenue, and there were 45% of those were substantiated cases.
Yeah, that's a big amount. And I know with this, we keep hearing the statistics about the aging population that is only statistically likely to grow given more and more people entering that age group. So is part of your budget ask hiring people, investigators, what?
It encompasses a small growth, a small percentage, but there was an increase of $3 million to address caseload growth. We are working to improve protections for older adults. There's legislation that we introduced this time to help with financial exploitation, to add financial institutions, which is the largest number of cases, help combat that issue. And also to put transactional holds so that if people are at a financial institution, it gives the financial institutions the ability to hold for a second. Because once the resources are gone, it's a lot tougher to recover them. So we're working closely and hopeful to get that passed and make them partners. We already train financial institutions, et cetera, but we want a better partnership to help with this issue.
Thank you for that. Two more questions. My next question is related to federal funding. And so I'm glad to see that there's not only the same funding, but a little bit more. And I know that, is this the summer that the Older Americans Act is being voted on again? I know every 10 years it's renewed. So is that coming up this summer? Or?
Well, I don't even pretend to predict what's going to happen at the federal level. However, I know we have advocates here that have gone to DC to advocate to sign that again, the bill again. For the Older American Act services. We have received our funding, I believe, our allocation, and we know the federal fiscal year is in October. So this past year, I believe we got our federal funding, and we're hopeful that will remain in the future.
So again, this is on people's radars. I'm hearing it from people in my community about that. Is there any kind of contingency plan or thought that in case for some reason that doesn't get renewed, or, that would be pretty significant?
It'd be pretty significant and devastating for programs. The Older American Act services, as I mentioned, are not means tested. That means people have access to those services, those people who may need it in other ways. And I think that's just an important element. So when these other programs, and let's not even deal about Older American Act funding, let's talk about programs like SNAP and other things that older adults rely on. When they go away or there are different requirements, they rely more heavily on these other programs like meals and other things. We are hopeful and continue to work closely with our network to keep a gauge on it. The problem is we can't supplement all the costs that if it's taken away from the federal government, the state is unable to do that.
Right. No, and more reliance on community partners. Even now, I think there's more reliance on community partners just because of as the need is increasing. I know I've seen it in my district. My last question just goes back to the wages for a minute. Certainly. I know we're going to have a hearing on this, but while I have you here, I want to ask the question. So
I'll be here for the hearing too, by the way. That's
okay, good. You mentioned that it's $30.80 per hour, and then the actual amount the difference between that and what the wages are is It's like $7.08 is the difference between, you said it was like 77%?
Right. So we, in our program, and we're one of the few states that had a percentage, our program requires 77% for every dollar that's put in there goes directly to the direct care workforce. So although they get paid a wage, over and above that talks about benefits and other programs, but it has to be directly attributed to the workforce. So there's very few things that providers, and you'll hear testimony, can do. They only have that other percentage to work with. And they pay for all the overhead and all the unfunded mandates with that 23%. So the increases, they have to fit that in with the other insurance costs and other things that they pay for. And so it's just trying to illustrate that although the wage is $18.75, actually $23 and whatever the $23, I think it's 72 cents, goes directly to the workforce in some way, shape, and form. And so I just wanted to point that out. I think we forget that. That's unique to our program, unique to this state, although there was some the federal access rules listed a change that would be coming in maybe 2030. We don't know if that's still going to happen, where they want to move the needle on that. But I just wanted to point out we've been doing that for a long time.
And do you set that percentage?
It's in rule and statute, so it's been in our administrative rules for a long time. And it has been a factor, and we verify that the providers have to provide a direct care worker certification form to us, and we verify that with their audits and stuff every year as we look at the material.
Do they have to be full-time
No.
No.
The workforce varies, and the workforce, you remember, they can have a family member care for them. And our program saying if your family member works for you, you don't have to take on other clients. You can just work for your family member. And our program is person-centered, so it centers around the individual, their needs. So if that person only needs 4 hours of service or 2 hours of service, that's the hours you get as a worker. However, you can work for other and multiple clients, but it's person-centered. It's dependent on the needs of the individual.
Okay, thank you for that. I might have more questions, but I'll save it for that hearing. No further questions, Chair.
Thank you.
Thank you, Representative. Are there any other questions for the Department on Aging? Okay. Thank you so much, Director and staff. Thank you for all that you do for our seniors. We are going to hear from two organizations in the aging space to talk about budget issues that will be facing, constraints that we'll be facing in the coming year. And our first panel is the Illinois Association of Area Agencies on Aging. We have Diane Slezak, the CEO and President of Age Options, and Susan Reel, CEO, East Central Illinois Area Agency on Aging. So thank you for joining us this morning.
Thank you so much for having me. Madam Chair Muller, Vice Chair Lilly, and Republican spokesperson Weber, thank you so much for having us today. We're here today to support the Department on Aging's budget, but also to point out some additional needs that we are just incumbent on letting you know as advocates for older people, especially those who cannot speak for themselves. I am the Chief Executive Officer of Age Options that serves suburban Cook County, but I'm here today on behalf of all the area agencies across the state of Illinois. Last year, we served 426,000 older people, perhaps not at the depth of the community care program, but with home-delivered meals, chore services, transportation services, and a lot of help with benefits, especially during this period. I am not going to read from my testimony. You have a lot of other figures in the written testimony that I think was distributed to you, but I do want to turn to some charts that you should all have in front of you. Maybe I should have done a PowerPoint, but hopefully everybody has these. The first chart says disaster in big red letters. You might feel it's overly dramatic, but sitting in my chair right now at the area agencies on aging, we are already cutting back meals to older adults. even as many meals as you mentioned that we are serving, we at my agency and several others right now have cut people back from 7 meals per week to 5 meals per week. We've cut back people who needed 2 meals per day, a hot meal for lunch and a cold sandwich for dinner. We've had to cut back them to 1 meal per day. And our meal boxes that we particularly curate for cultural populations, for the Black African American population, Latinx, Arab American, et cetera, those meal boxes have now been reduced, and we're in the process of reducing them. So it is disaster for us. It's just horrible to sit and think about making those tough decisions. We've already cut back some services at my agency. We'll no longer be doing chore services so that we can move more money over to the meals program, because that's the, if you don't have food, I don't know how much anything else matters. But if you could turn to the next couple of pages, I'll go through them pretty quickly, but you see in the first one, there's been a 37% increase in the older adult population between 2010 and 2024, while there's been an 8% decrease in the population of those between 1 and 59. There has been, the next slide down, 100% of people under the poverty level. And the poverty level is noted at the bottom there. It is quite low, $15,960 per year for an individual, and imagine living on that much money. But a 72% increase in the poverty level in that population, while there's been a 17% decrease in the population. This data all comes from the very recently released American Community Survey data from the Census Bureau. So the next page turns to a little bit of what Representative Ness was asking about earlier, which is the SNAP benefits. There's been a 171% increase between 2010 and 24 in the number of older people who are using SNAP benefits. And I will tell you that older adults use those much less than the rest of the population. The bureaucracy of applying and the feeling that many older adults have that there's somebody more deserving than me. Like, I don't need these as much as somebody else does. And then just a 34% increase in the rest of the population. The rising cost and limited funding, the chart at the bottom is only from Suburban Cook, but it is representative of other areas. We have had a 31% increase in what it costs us to deliver the meals in our area. There are a couple of other slides here on our caregiver program, and that is another program that keeping caregivers in place and the impact on caregivers of the loss of SNAP benefits has been very detrimental. We are so grateful. I mean, the state of Illinois has been so generous in terms of the meals allocations, but we are, last week you might have heard that there's reductions of 10% proposed in the discretionary programs at the federal level, which would include the Older Americans Act, and the already in place reductions in SNAP benefits have also had a huge impact. I happen to be on our National Board of Area Agencies on Aging, so I keep very close track on the Older Americans Act reauthorization, and I am assured that our funding will continue even if the reauthorization doesn't. We've gone up to 8 years without reauthorization. However, the funding just is not keeping pace at a federal level by any means. And even though we know that it's a tough budget year, I just felt like I needed to be here to let you know what's happening at our grassroots level and what these numbers show you. Thank you for allowing me to testify.
Thank you, Ms. Lezak. Do we also have Susan Reel? Did you?
Yeah, we have Marcia Johnson, my colleague, I think from.
She's on our panel number 6. You're on our next panel, so we'll proceed.
No, Susan is my colleague, so I'm here to. Would be with I4A. I'm sorry. Somehow.
Okay, that's okay. We just had her listed as testifying, but that's all right.
Okay.
Are there any questions for Diane? I just want to note that the request that the Association for Area Agencies on Aging is to increase the line item for home delivered meals by $10 million. And that would keep,
Thank you. I neglected to add that. That would be able to help us keep our heads above water. This has been like a slow-moving train crash where we just are seeing the need increase and increase due to food security issues, and particularly concentrated right now in the Cook County area, but throughout the state. I am hearing from colleagues where there's just not enough money to get meals together. So 10 million is our ask. Unfortunately, our current estimates are that in order to avoid a waiting list at the current increases that we're seeing in Cook County, we would need 25 million statewide. But we would be very grateful for any additional dollars, and 10 will keep us from starting a waiting list is really difficult right now. If you start a waiting list, we just don't get people off. They're staying on the program longer. So you add somebody to a waiting list and give them hope, but there is not much hope. I'm sorry. Thanks.
no, thank you. Thank you for that testimony. Are there any questions before we go on to our sixth panel for Ms. Lezak? Okay. Thank you so much, Diane, for your testimony. And now we will have our final sixth panel for our subject matter on the budget, and that is with Marcia Johnson from the Coordinated Care Alliance.
Good morning.
I'll be right behind you.
All right, thank you. Good morning, Chairperson Mueller, Vice Chairperson Lilly, Republican Spokesperson Weber, and other committee members. I'm Marcia Johnson with the chair of the Coordinated Care Alliance, and on behalf of our member organizations, we're the care coordination units in the state of Illinois that are contracted with the Department on Aging to manage the care for the older adults in the community care program. I appreciate this opportunity to speak before you today. We're very grateful for the proposed increase of approximately $5.2 million in the case management line for the budget for the Department on Aging. We know these are difficult times for state government fiscally and otherwise, but the proposed increase does not cover the costs we need to provide services to the older adults in the community care program, and it's for this reason remain neutral on the proposed budget. As you recall, I appeared here last year and I talked about the range of tasks that we provide for the community care program participants whose tasks are responsible of the managed care organizations. We are not reimbursed by the state for that work, and of course it's not financially sustainable. This continues to be a problem for our members, and we continue to advocate for a solution. But the lack of reimbursement is just not a fiscal matter for our agencies. It also means our care coordinators can't devote their full attention to serving the individuals in traditional non-MCO CCP with time absorbed by serving those MCO participants. My care coordinators have to prioritize the frailest and chronically ill CCP participants over those seeking just the basic wraparound services such as transportation, home-delivered meals, Older Americans Act services, and senior center programs. And that's not fair for the CCP participants whose services are delayed. Such delays in providing home care services raises the risk of older adults becoming injured or ill to the point where they need hospitalization, rehabilitation, or nursing home care, which considerably increases the cost to the state budget and puts additional strain. With the state transitioning also to the new Medicare Advantage dual-eligible special needs plans for individuals enrolled in both Medicare and Medicaid, these plans known as D-SNPs, the CCUs are already hearing from the many older adults who are confused about this new program and the processes of what it means to them. We expect the CCP participants will encounter the same disconnect with the D-SNP coordinators going forward as they do with the MCOs, and that those individuals will continue to turn back to us for assistance and advice. As we spend time assisting the MCO and these participants, again, it's not reimbursed. Aside from the MCO and DSNP matters, there are a wide range of activities and tasks that we perform in the service of CCP participants that were not fully reimbursed. I will state that we are in ongoing negotiations and discussions with the Department on Aging, who's been a wonderful partner, to discuss the increase in these costs. But absent additional funding from the legislator, rate increases are not possible. Suffice to say, we appreciate the recommended funding increase, but it stops well short of what the CCUs require to meet our labor and operational costs. Some CCUs have been forced over the past few years to close their doors. The disparity cannot remain unaddressed without jeopardizing the system or the viability of this critical component of the state's elder care system. We respectfully submit that an additional $6.5 million would go a long way to making our members whole, while bolstering to be able to better serve the needs of our older adults. That's a $50 increase for every one of the 130,000 seniors that are on the community care program. We also echo the position of the I4A and the AAAs in calling for a larger increase in funding for home-delivered meals. Sadly, the demand for home-delivered meals is rising and is expected to increase exponentially, particularly amid the cuts to the SNAP benefits. I look forward to working with you and the administration as we move forward through the budgeting process, and I appreciate your time, and I'll answer any questions.
Thank you, Ms. Johnson. We appreciate your testimony. Are there any questions from members? I just have one question, and this might also be directed to the department. I know this has been an ongoing problem with the MCOs, kind of a struggle between who's responsible for providing certain types of assistance to customers, seeking assistance, whether it's the CCUs or it's the MCOs. And at some point, I think we need to bring HFS into this conversation. Note that we're going to be going out for RFP again with our MCOs and, solidifying terms with them. We don't want the state paying duplicating payments for services that aren't being rendered. So I don't know, Director Keela, if you have any comments on that coordination with HFS?
Well, we're well aware of the problems, and I want to thank the care coordination units. I think they're a victim of their own good work sometimes, because if you help somebody and they're responsible for the state to do the eligibility for these services and programs, not only for the community care program, but for also managed care. So if I meet you, you do my eligibility, you're really nice to me, you tell me about these opportunities. If I need help, and I'm like, oh, well, I remember that nice lady that helps me, and I just think it's the nature of people. And we are just built an aging network to not turn people away, right? Because, just because, why should somebody figure out, oh, I'm under this umbrella now versus that umbrella? And so I just think it's just part of the nature of they're known in their communities doing the work. But we do have to work harder to make sure managed care, because that's what we're paying for as a state. They're paying for the case management piece, and that was taken away from, or moved over. I don't want to say taken away, but moved over to the managed care. We just have to get them to work at that same level and feel like that connection, just like these individuals through care coordination. Unfortunately, as a state, as a waiver program, we can't pay them for the same work of doing that because we're getting personally reimbursed from the federal government. And so that's one of the dangers. But we're aware of the issue and just have to work with our sister agency on doing that. But human nature is human nature. And we don't want to turn people away. And so that's the only thing about that. People shouldn't have to figure out if they need help. They should be able to call anyway. This is all state services. But we have to just figure out a better way to share the burden, I think.
Thank you. Representative Ness, do you have a question? Oh, Leader Lilly?
Thank you, ladies, for caring for such a vital population. And I'm going to be there soon, so thank
No, you won't.
But with that, one of the challenges that I have seen with the families that I talk to, the care coordination case managers or caregivers tend to have high turnover. And I'm wondering, are there any thoughts around this to ensure that the families are not going without, because when that turnover occurs, a family will not have a caregiver for weeks. I mean, sometimes months. So I'm wondering, is there some thoughts and some plans around that issue?
So are you talking like caregivers, like direct care workforce or care coordination individuals? I want to just borrow what my colleague from DCFS said. The work can be very difficult for individuals. And I think we put a lot of quality controls and monitoring over these programs, but we require additional training, and we require the care coordinators have a social work degree, and it's very demanding. You walk into situations. So we try, and we have constant continual education requirements, and the pay is not that great. This is just the facts. The pay is not that great. So I think that those are some of the challenges systemically it is to keep people in the workforce. We didn't used to have this problem because people were so mission-driven and committed. But I think nowadays when people have options, like Representative was talking about working from home, you can't work from home when you do casework. And so I think it's just challenges with the people coming in wanting different expectations from employment and don't want these mission-driven jobs that don't pay well and they can't work remotely.
Thank you for that. The care coordination is challenging, and you have the partners and the caregivers to help make all of that happen for a family. I'm just hoping that there will be some thoughts and some plans around the weaknesses that are occurring in those areas. I do believe the good work is there, but I get to hear where we're just falling a little short, and I just wanted to bring that forward. If there's any plans, we would love to hear about them.
Well, thank you, and I think all the work we do with caregivers, both paid and unpaid, and putting resources like respite and other services in place, we are hopeful to have those type of just discussions. How do we add quality to a program through like our planning sessions, like with the multi-sector plan and the state plan, where we bring these issues to the forefront, but really try to fill in the gaps. Because I agree with you, there are some people who are more isolated and struggling, and how do we fill in those gaps for people when they're providing caregiving and services? So there's more that we can do, those will be part of those discussions so that we can find some innovative ways to improve the process.
And we're working really hard to hire like our care coordinators who are bachelor level degree positions to help arrange all these services from people from within the community. We're finding much success that if our care coordinators come from the community, they have a better investment and they want to assist their neighbors and that, and they have a specific driven mission to help the seniors there. But it's hard. I mean, we're an entry-level job, so I mean, they start with us, we train them for 2 or 3 years, and then they move on to the managed care organizations where they can make $50,000 more than what they're making with me. And so I do all the training and the groundwork to get them to where they are today. But again, we don't work from home. I mean, they're in the participants' homes. It is very challenging work, but in the same breath, I can say it's also very rewarding, because if you can link someone to all the variety of services that we have and keep them in their home of their place, of their choosing, then that's very successful for us.
And that's why I asked the question. There are some challenges there to keep that good work going, and I'm just asking, there's some thoughts around how we, the legislators, can assist in making that better.
Thank you.
Thank you, Leader. All right, are there any other questions for our final panel? Okay, seeing none. Thank you so much, Ms. Johnson. We appreciate you being here and your testimony. And now we have our last item is a subject matter hearing on House Bill 4662. Representative Canty. Chair recognizes Rep. Canty to present House Bill 4662. And then we will read the witness slips. So, floor is yours.
Thank you so much, Madam Chairwoman, minority spokes, and members of the committee. I am here today to present House Bill 4662 regarding our home care workers in the community care program. These folks are the backbone of our care system, providing invaluable support to our most vulnerable Illinoisans, from those struggling with Alzheimer's to those with physical disabilities. The work they do isn't easy. They bathe, dress, and feed people and allow them to live with dignity in their homes. They provide critical medical assistance, help patients get in and out of bed, and provide companionship. Simply put, they are a lifeline. Care workers dedicate their lives and time to caring for others, yet they're unable to care for themselves on their low wages. Many care workers consider their work a calling and form strong bonds with their patients. But too often, they are left with no choice but to find a new job to pay the bills. That's why home care workers are leaving the industry at a rate of 50% higher than the average occupation. They can't afford to stay. With each departure, the care crisis deepens, making it even harder for Illinois seniors to access the support they need. Without support, seniors may wind up with no other option than nursing home care, which can cost our state up to 5 times more than home care. House Bill 4662 is critical legislation that would increase the wage floor for home care workers from $18.75 to $20.75 per hour. This modest $2 an hour increase will help ensure that those who care for our loved ones can pay their bills and stay in the industry. And with me today, I have Jackie Rodriguez, the Home Care Division Director with SEIU, and Kayla Watson, a home care worker from Springfield. I welcome any questions.
Thank you, Representative. Before we hear from your witnesses, we do have witness slips. We have 7 proponents. Andrew Kretschmer on behalf of SEIU Healthcare, Illinois, Indiana. Darby Anderson from Addis Home Care. Heather Weir-Vaught on behalf of Help at Home. Jackie Rodriguez from SEIU Healthcare. Kayla Watson from SEIU Healthcare. And Trinity Perkins from SEIU Healthcare, along with Diane Slezak from Age Options. We do have 3 opponents who have filed. Let's see. It's Becky Dragoo from the Department on Aging, David Kuraniak from the Department of Human Services Division of Rehabilitation Services, and Director Kelo from the Department on Aging. And as I mentioned, there will be some testimony from our agencies as well. But with that, your witnesses have the floor. Thank you.
Button. Thank you, Representative Canty. Good morning, Chairwoman Moeller and members of the committee. Thank you for letting me testify. My name is Jackie Rodriguez, and I'm the Division Director and Vice President of our union, SEIU Healthcare. Our union represents 37,000 caregivers who take care of seniors through the state's community care program, also known as CCP. Home Care for Seniors is the state's largest and fastest growing long-term care program. It allows 130,000 seniors in Illinois to remain living in their homes, receiving services instead of in nursing home facilities. This is a huge cost savings for the state. CCP is a win-win for seniors in the state budget. Seniors overwhelmingly prefer to remain in their homes as they age, and it's by far the most cost-effective way for the state to meet its rapidly growing long-term care demands. When CCP is not a viable choice, Illinois is likely to pay many times more when seniors give up living in a home and having to go to a nursing facility. As you heard from Representative Canty, nursing home costs almost 5 times as much more than home care on average. In IDOA's budget presentation, CCP saves the state $270 million per month, a number that does not account for the tens of thousands of seniors who receive services through the managed care organizations. This is billions in savings each year. However, there is a workforce crisis. Right now, many seniors who are approved for services cannot get the care they need through CCP, often because there are not enough home care workers available. In 2024, there were 12.3 million authorized CCP hours that were left unfulfilled. That's about 20% of all the authorized service hours. We estimate that this means 20,000 seniors are approved for home care but receive none of these authorized hours. At the current wage levels, the average CCP care worker is only making $22,000 a year. Industry surveys show that providers rank pay as the main barrier for recruitment. Right now, a CCP caregiver gets paid an $18.75 starting pay. They are falling behind their counterparts in the state's existing programs. So I want to give you an example. In the state's home services program, a personal assistant will start earning $20.75 starting in January of 2027. This is the same pay rate that we are proposing for CCP caregivers. Direct service providers who care for the developmentally disabled, they also saw a raise of 60 cents. Many of them will be seeing their pay to $21.90. We can't afford for CCP caregivers to fall behind. In the proposed IDOA budget, most of the increase is for program expansion. CCP is popular, it's successful. This is a good thing if it is able to recruit and retain the workforce needed. DOA's budget also includes a smaller amount for what it calls annualization of the rate increase for fiscal year 26. To be very clear, this is not a rate increase. It means maintaining the current rate at its current level. As you heard from DOA, yes, there have been increases to the rate, which come down in the form of raises for workers in the past several years, but that has largely been due to the advocacy of our union and unionized caregivers who fight to increase wage standards for workers. I urge your support for House Bill 4662 for both home care workers and seniors. Our bill does 2 things. It raises the minimum rate to $20.75 effective January 2027, and it increases the rate that agencies must spend on the direct service worker cost from the current 77% to a modest 79%. Thank you again for your time.
Thank you so much for your testimony. One more? Thank you.
Good morning, Chairwoman Moeller and members of the Appropriation, Health, and Human Services Committee. My name is Kayla Watson, and for the last 12 years, I have been working under the Community Care Program with Help at Home. I am also a proud member of SEIU Healthcare. I'm here today to speak about the need to invest more in our seniors and caregivers like me who work to keep them in their homes. Research shows that the seniors enjoy better health outcomes and live longer, fuller lives, and they're provided when they are provided in home care instead of being warehoused in nursing homes. I love my job and I take pride in my work. The care we provide to keep our elders rooted in the communities and in their homes that they spent their lives building. While we've made progress in the last few years and finally raised the CCP rates minimum wage, above minimum wage, we still are not properly valuing the hard work for caring for our seniors, for them to live a longer life inside of their homes that they've built their lives for. I also work in the DOORS program serving people with disabilities. On top of working for seniors through the community care program. Thanks to our latest DOORS contract, DOORS workers will be getting paid $20.75 an hour starting January of '27. That is below the CCP minimum wage of $18.75. We can't let the community care program fall behind, especially when the work is very similar and is already facing a shortage of workers. In the last month, I've had to ask my supervisor at Help at Home to take on another client just to cover the gas prices. I service multiple clients through Sangamon and Christian counties. An essential part of my job is providing transportation to and from doctor's visits and the grocery store. On an average, I am putting 500 miles per week on my own personal vehicle. When gas prices spike, home care workers pay the difference, especially downstate where we have to drive longer distances. Meanwhile, Medicaid and SNAP cuts are about to strip many home care workers and their clients of the support they need to make ends meet, even as the prices of groceries and other essentials continue to increase. I've also witnessed firsthand the devastating impact cuts to SNAP benefits that have had on my clients, most of whom are living on a fixed income and off of Social Security. One of my clients is a 69-year-old woman who suffers from a brain tumor and diabetes. Because of her brain tumor, she suffers from memory loss and has difficulty cooking meals by herself safely. On multiple occasions, she has left the stove running while cooking dinner and fallen asleep or left the home because she simply forgot that she was cooking. Without a home care worker to monitor her and keep her safe, she would more than likely end up in a nursing home. She relies on food banks for her nutritional needs, but because she's a diabetic and the doctor instructed her to remove carbs and sugars from her diet, the food bank gives her things like loaves of bread, pasta, rice, cereals, things that she cannot eat. So I often come out of pocket of my own to buy her meat and produce just to meet her dietary needs. That means that I'm taking away from my own family to ensure that she is properly cared for. I also do her laundry, meal cooking, prepping, bathing, cleaning, scheduling appointments, taking her to and from the appointments, and leaving notes around her house so that she remembers what to do when I am not in the home. Illinois must take action now and pass HB 4662 to invest in seniors and the workers that care for them. Balancing our budget on the backs of working people is simply not an option. I urge you to use the power the people have entrusted you with to stand up for working families across our state and be the champions we desperately need in this moment. There are options on the table that would secure the resources we need to protect Illinois home care systems from looming federal cuts. I strongly urge you to pass a rate increase, raising pay for CCP home care workers to $20.75 an hour so people like my client can safely stay within their homes. Thank you.
Thank you so much for your testimony and, more importantly, what you do for seniors in our community at a great sacrifice. You guys are the unsung heroes of our state. Are there any questions? All right, I know we do have testimony from the departments. If they would like to come up and provide brief testimony. Feel free to proceed, but introduce yourself again and for the record.
Good morning, Chair Moeller and members of the Appropriations Committee. My name is Becky Dragoo. I'm the Deputy Director at the Illinois Department on Aging. I want to preface my comments and echo the sentiment of many in the chamber today that how much we value the work of our in-home workers and the critical role they play in helping the department meet their mission in older adults remaining and thriving in their home and community versus nursing home. But the reality is a little bit different when it comes to our budget, and we've submitted some documentation that the annualized cost of the proposed rate increase is $171 million to our agency's budget. That does account for growth in utilization, but what it doesn't consider is a growth in the number of providers that we have, which is a terrific thing when you think about the increase in providers to provide those vital services to individuals, but it has to be accounted for when we think about the annualized cost of $171 million and the growth in our community care program providers. I'd also add that the department, the General Assembly, the Governor's Office have done a terrific job since 2019 of trying to compensate our in-home workers appropriately. Since 2019, when the provider was $20.28, today that rate is $30.80. The wage that supports has gone from $12 in December of 2019 to $18.75 today. That's remarkable. That represents increases in December of 2019, January of 20, April of 21, November of 21, January of 23, April of 23, January of 24, January of 25, and now January of 26. The director mentioned in her remarks about our budget that the department is undertaking a rate study, and that's true. The waiver requires us, the CCP waiver, that is the Medicaid waiver, requires us to do that every 5 years with good reason, because it requires us to what they do call rebasing. And that's to ensure, do we have an adequate number of home care providers, and are we compensating them appropriately to sustain the services in the CCP program? So critically important to inform our agency, to inform members of the General Assembly that we are paying not just an adequate rate, but an appropriate rate in comparison to other states, similarly sized states serving a similar number of individuals with a similar Medicaid budget. This time, when we undertook the rate study, we took great care in selecting a vendor, and we've engaged in all of the members of our community, our in-home providers. We've solicited their comments. We've left open that comment period for additional feedback, so we truly want to inform that rate study the best way that we possibly can. We've engaged our CCUs, our APS providers, our ADS providers for their feedback so that they can tell the rate setters, this is what it means, this is what I do, these are the gaps in compensation. And this way, when we have that rate study in the fall, we can make an informed decision about where we are up against those rate increases that I just mentioned from 2019 to the present day. The reality is we don't know where we are. We don't know what an appropriate rate of compensation is until we look at that compensation study, which again will be out in the fall of this year. And I'd also like to comment that it isn't just about compensation. Yes, compensation is important, but it's also about training and education and flexibility in our rulemaking and our policies. So the department has gone to great strides to address the direct care work shortage and to professionalize and provide career ladders to members in the direct care workforce. We've partnered with Rush University to develop a core curriculum that will span waivers, not just our own waiver. And in doing so, we're breaking down silos and we're providing a foundation to provide that care with a future goal of providing additional courses around mentorship and also courses in Alzheimer's and related topics so that a direct care worker has the confidence and we know the program has the quality that it needs to meet. I'd also like to mention a couple of other things that we've done. We are contemplating and set to adjust our rules to provide a little bit more flexibility. The director mentioned that we currently have a 77% cost split, which is true, that goes to the workforce. We are moving to improve our flexibility in our rules to allow that also to include incentive to retain the direct care workforce as well. These are small steps, but they're critical steps to address the other factors that drive turnover in the direct care workforce. I'd also like to touch a little bit about the increases themselves, although, and I think the director mentioned it, the rate increase is the floor. That's the minimum that a worker must be paid when the General Assembly passes rate increases, and we amend our waiver to accommodate those rate increases. The reality is that that because of union contracts, direct care workers in many instances are paid more than that by virtue of longevity programs or tenure in their positions. So it's not just the rate increase that you're contemplating today, it's also the fact that those collective bargaining agreements will reopen for providers that are represented by employees to then negotiate the impact of that new rate increase. And then lastly, I would also like to talk about utilization. This is a second year in a row that I've heard that increasing the rates for direct care workers will impact the utilization and that there's hours left on the table, that if we only paid the direct workforce more, that they could provide those hours to older adults. And that simply is not true. Individuals are assessed for their care, and they're provided with a score. That score translates to their nursing home eligibility. And that score then ties to it the maximum number of hours that they can receive. That's required under our waiver so that we can ensure the cost neutrality of providing services in home and community base versus in a nursing home institution. Again, the maximum hours that someone can utilize under the program. Rarely do they use those hours because it is person-centered, and their plan depends upon the numbers they actually need, the number of hours they actually need to stay in the home. So to suggest that if we paid the workers more, we would bump up the utilization, again, is simply not true. That utilization, that score is based on a person-centered plan of care. We average around 77% of utilization, and that's a number we look at closely because of the cost neutrality requirements in the waiver, and it's a flag for us. If a provider is meeting that 100%, something's wrong there. They need a reassessment, they might need more hours, or there's a problem, all right? They're exceeding the number of hours in the care plan. Similarly, if it's lower, we've got another question to ask. Why is it lower than the hours they've been assessed for? So I just want to set the record straight with regard to utilization. And then lastly, one more thing. I do want to talk about the rate increases that were mentioned for the other waiver for HSPs, the home service providers. Yes, they provide a very similar service, but we are totally different models. So our model is what we call an agency model, where the Department on Aging contracts with providers. Under the other case, in the DOORS waiver, those are self-directed employees, and they hire those employees directly, and or they're collectively bargained, and or state employees. So there is a little bit of a difference there, and I understand why as a worker you would look to another group and say, wait a minute, you know, we're similar, what's going on there, and why we can't match those increases. But the reality is the services they provide are a little bit different. It's a different population of individuals than the older adults, and their wages are set a little bit differently. And
thank you, Ms.
Thank you.
Dragoo, and we're going to be hearing from the department, from DOORS, right now.
Good morning, Chair Moeller and members of the committee. My name is David Kriniak. I am the Bureau Chief of the Bureau of Home and Community-Based Supports for the Division of Rehab Services in DHS. I oversee the Home Services Program. To start, I mean, regardless of the agency's position on the bill, this year agencies have been directed to oppose bills with a fiscal impact and request sponsors to direct their request to budgeteers. The bill has an estimated fiscal impact of $6.5 million, and as a result, the agency is opposed. We encourage the sponsor and bill supporters to work through the established budget process with budgeteers in each chamber. I'm happy to take any questions.
Thank you. If you wouldn't mind stating your name for the record as well.
Yes, my name is David Kriniak.
Okay, thank you. I apologize. Thank you. Thank you for that. All right. Are there any questions from members? Looks like we're getting thin as other committees are convening. Thank you, Representative Canty, for bringing this bill forward. Again, this is a perennial issue that we need to address at the state.
Thank you.
And thank you to our agencies. Thank you to SEIU Healthcare for your advocacy. And we will definitely be talking about all of these issues as we proceed towards the end of our session and our budget negotiations. With that, I do want to announce that we will be meeting again next Thursday, April 16th. We're going to continue hearing from our state agencies. Next week, we'll be hearing from the Department of Healthcare and Family Services and the Illinois Deaf and Hard of Hearing Commission. And with that, there being no further business, the House Appropriations, Health and Human Services Committee will recess to the call of the chair. Thank you, everyone.
The hour of 10 a.m. having come and gone, the House Labor and Commerce Committee shall come to order. We are in a recess call. There being no further business, the House Labor and Commerce Committee will recess to the call of the chair. Thank you.